Good evening. Today is Wednesday, May 13th. Welcome to the weekly live Facebook question and answer forum hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Public Information Officer Amy Vickery. We will both be moderating tonight's live event, which will be recorded and posted to the Stan Emergency Facebook page and YouTube channel.
You won't see us on screen tonight, but you will hear us as we help direct your questions to our panelists.
Last week, we made a minor change to our forum. To allow for a more meaningful and effective communication, users will be limited to 5 responses or comments. We hope this will prevent spamming comments, yet still allow you to share your viewpoints and ask questions.
We also have a special guest joining us tonight. Assemblymember Adam Gray is here to discuss what is happening at the state level. Sheriff Jeff Dirksey was planning to address law enforcement tonight, so we have posted a video to our Stan Emergency YouTube page where you can find more information on that. As for tonight, our other 2 panelists are Dr. Vaishan Payan, who we will refer to as Dr. V, and Stanislaus County Board of Supervisor Chair Kristen Olson.
Let's begin tonight's panel with Dr. V for an update on the number of cases here in Stanislaus County. Dr. V, where do we stand tonight?
So today we're reporting 526 confirmed cases, and sadly, again, we had another death today to bring our total deaths to 23.
Dr. V, we're going to stick with you for a moment. Our numbers have been increasing as expected since we ramped up local testing options. Yesterday at the Board of Supervisors meeting, you provided some data about hospitalization numbers in our county. Can you share that information with community members who may not have seen that presentation?
Sure. So I know that these slides are going to be very small on the page for you, but they will be posted later so that you will be able to see them and refer to them. So if you look at the first slide, we are looking at cases, and these cases, I'm excluding the cases from the skilled nursing facility. So these are all cases except those that happened in that one congregate setting. And the reason for excluding the congregate setting is that we're really trying to look at what is going on in the community. What are we seeing for community transmission? And it's not like I'm trying to make it less that there was cases in this congregate setting, but it's not reflective of what we're seeing in the community. So as you look at that first one, these are all cases by the day of symptom onset, which is the earliest date we can get, so whenever someone started having symptoms. And you can see that we peaked with our cases around late March and early April. So if you look at the next slide, this is looking at hospitalized. And I like to look at people who are hospitalized because I like to look at the data from people who are hospitalized, because this is a good marker of where disease is in our community. The numbers, we can change total cases by increasing or decreasing testing, but if you really want to see a stable marker of transmission in the community, what we really look at is hospitalized, because we know that a steady proportion of all people who are ill will become hospitalized. So as you can see from this graph, and again, we excluded skilled nursing facility patients because we are trying to reflect community transmission. And so if you look at this, again, you can see that we peaked around late March, early April, and we've just seen occasional random hospitalizations since then for Stanislaus County residents. The next slide shows emergency department visits for influenza-like illness. And this is our syndromic surveillance. We look at cases, so the measure is people who come into the emergency department, what are they there for? What is their chief complaint? So they walk in and said, I'm having fever and a cough, and that would be an influenza-like illness. And we get these data, they're just de-identified, aggregated data of what people are going to the emergency department for. And we get these from all 5 of our hospitals. And if you're looking at that graph, you can see, it jumps up and down every day, but you can see that at the beginning of this graph, it was flu season. This is starting in February, and then we decreased starting towards the end of March, and we've been very stable and very low for our influenza-like illness. So next, this COVID-19 hospitalizations by our hospital data. So these are the people who are in the hospital in Stanislaus County. They're not necessarily Stanislaus County residents. They're just people that are in the hospitals in our county. And we look at this to see what our hospital capacity is. And if you look at this, as of today, we had 21 people hospitalized total. This is down from being in the 30s late April. This is showing about 2 weeks of data. So we have 1,209, I believe, licensed beds in Stanislaus County, and currently 21 of them are have people with COVID-19 in them. The next chart, the next slide you will see shows the hospital capacity and the ICU capacity. And this is on our website, as was the previous one. And you can see our hospitals are running about half full and our ICUs about half full as well. So this includes all patients, not just COVID patients, but all patients. So you can see there's great capacity in our hospitals, room for more patients. Not that we want more patients, but we have capacity in our hospitals. So the next slide is another surveillance marker that we use. We use it for flu. We use it for other respiratory viruses. So this is COVID % positive lab tests. And so again, you can affect the number of tests. You can affect the who you test. But this is a really stable marker by just looking at when you do 100 tests, how many of them are positive? And we have been running pretty stable for the month of April, about the last month. You can see about from April 10, running about 6% positivity, which is, you know, a low positivity. So out of every 100 tested, 6 people will be positive. So that's pretty common. If you look at flu data, at the height of flu season, we'll be up to like 35% of the tests being positive. So this is low. We just got low simmering transmission in our community. So the next slide, we're almost done. Second to last one, looking at clusters. And one of the reasons I wanted to show this is what we're looking at as we develop policy in the county. So this slide shows that I presented this yesterday, so it's data from a couple days ago. I finished this Monday, I believe. Out of 508 cases and 21 deaths, you can see from the one skilled nursing facility, 129 cases, Stanislaus County residents, and that's 25% of our total cases. So we have 25, a full quarter of our cases from the one skilled nursing facility, and at that time, 14 deaths. From the grocery distribution center that I'm sure you heard about on the news, we have 56 of our cases, or 11% of our total cases are from there. So that's a work site. It's a work site where it's difficult, if impossible, to keep the social distancing. And you can see you can have quite a bit of transmission in a work site when you're there 8-10 hours and not keeping a social distance. So obviously work sites are a place where we want to spend some time. And we did have one death at that work site. And then there was the family funeral, which was a mass gathering in a family's home, and it was about 50 people, and so far we have 26 that have tested positive, and about 5% of our total positives from this one funeral gathering. And luckily we have no deaths because we don't want this funeral to have more funerals associated with it. So for these 3 clusters alone, and we have other smaller clusters, but you can see that 211 of our cases, or 42% of our cases, and 15 or 71% of our deaths are from these 3 clusters. But they illustrate the risks for transmission in our community of congregate living settings, especially with people who are older, because we know age is the biggest risk factor for death and severe disease, work sites where social distancing can't be maintained, and gatherings, especially with events where there's a lot of emotion, and I'm sure a lot of hugging and close contact, and this is when transmission occurs. So as we look to go to the future and where we go as we open up businesses and things, we look at where we're seeing the most transmission take place, and that's where we want to take the most precautions. So the very last slide that I presented, and I'll go through this quickly, there's also potential harm from closure and stopping a lot of the activities that take place, people's ability to earn incomes and provide food for their families. So one of the ones we looked at was the harm from suicide hotline calls. The mental stress that people are feeling from this, and it's stress from the coronavirus, it's stress from news and fear for the virus, it's fear from how are you going to move forward when you don't have your job. There's a lot of stress out there. We're all feeling it. So you can see on this chart for 2019, for the first half of the year, they averaged 11 calls per week. And in 2020, from mid-February through close to the end of April, the average is 46 calls per week. And this is some good news as well. So it's good that people are reaching out and talking. We have not seen the suicide rates go up. Deaths from suicide have not increased, which is great. Some of the reason for this increase could be that other avenues are closed, like schools are a place where people can access care rather than calling the hotline. So calls will be up because this is one of the places left that they can go. Hospitals are another place, and group sessions. So there's many reasons for increase to the call, the suicide hotline, but it does concern us, and we do also like to look at harms from what's being done. And as a reminder, the number for the suicide hotline, if anyone needs it, is 558-4600. So thank you.
Thank you very much, Dr. V. And I'm going to stick with you before we get to our other guests. And by the way, we appreciate you bringing those slides along with you and running through some of the numbers. Yesterday at the Board of Supervisor meeting, you also made the decision to rescind the county's stay-at-home order. So can you explain what this means to the people in Stanislaus County?
Yes. So it actually doesn't mean a whole lot to the people of Stanislaus County. So we are under the governor's order. That is the law of the land. By statute, I have to follow the order of the State Public Health Officer. That is law. So when this all first started on March 19, the governor and the state public health officer put the stay-at-home order in place. But there was very little guidance and interpretation around it, if you remember. There was just a referral to a website where you could look at what was essential and what wasn't essential. And so we had a lot of requests to help people define what that meant. So the first order was written in an attempt to define to interpret the state public health order for stay at home. As we amended it, as we got further interpretation, so we amended that order twice, interpreting the governor's and the state public health officer's stay-at-home order. I think at this time it's causing more confusion than it's helping, which is why I rescinded that order. I'm only allowed to be more strict than the state, and I don't see a reason at this time for the general public to be more strict than the state. So there are still some orders in place. The orders that are still in place are for isolation and for quarantine. So isolation of those who are sick so they don't spread the disease. Quarantine is for those who have been exposed and are at the highest risk for becoming ill. And then there's an order to protect those in congregate living settings, so it applies to skilled nursing facilities and other places, assisted living facilities, where people who are older and at increased risk are living and at increased risk for spread if it gets there. And the first responders who may walk into there, just ensuring that they're screened before they go, because you don't want to stop them at the door and screen them. And then the last group is our essential food and beverage manufacturing. So if you've been reading the newspapers and seeing what's going on around the country, there's been a lot of problems with the food, especially the meat industry, because it's not possible to keep your social distance, that 6-foot distance, when you're working in these plants. And so in an effort to keep these plants up and running and food in our grocery stores and on our table, I worked with some of our bigger industries who really are doing a great job in keeping their workers safe. And we took some of those best practices and put them into the order for the smaller ones who aren't as connected with, like the CDC, and getting guidance straight from them. And since then, good guidance has come out from the CDC, but at the time we put that in, and currently as we're keeping it in, it is really to keep our food chain stable and up and running and prevent outbreaks there. Thank you.
Thank you, Dr. V. Lots of great clarifying information from you this evening. Let's go to Supervisor Olson. We were just talking about the Board of Supervisors' action yesterday, and we know that the board voted to rescind the local public health order. So can you talk a little bit about that and the other action the board took? And also, what's in the state order that's different than what we had in place?
Sure. I appreciate the question because there has been a lot of misinformation and misrepresentation of what took place at the Board of Supervisors meeting yesterday morning. And so it's important that we make that clear. As Dr. V just discussed, the first thing that we did based on her guidance, and it was actually her action, was to rescind the local public health order. As Dr. V explained, the purpose of a local public health order is to be stricter than the state order when such local data and science suggest that we should be stricter. And we are no longer in the case where that's needed. So the orders remain in place for congregate living facilities, such as skilled nursing facilities, for food and beverage manufacturers, as Dr. V just explained. But other than that, we rescinded the local orders, recognizing that the state order is in control statewide, including Stanislaus County. The second thing we did is direct the CEO to work with the Board of Supervisors and the Public Health Officer on preparing all the documentation, including a letter that provides all of our documented local data points, how we meet the various state criteria that's been handed to us, et cetera, so that we can send all of that documentation in what's called an attestation request to the governor's office, requesting a county variance so that we can be empowered to make local decisions guided by the public health officer based on our local data and science. This was something that until last Thursday afternoon, we were under the understanding, based on our conversations with the state over the last several weeks, that we already had the authority to do. And then that changed last Thursday. So the process now is to submit documentation asking for this county variance. And we will be doing that, submitting those documents on Friday. And then the final thing we did is we directed the CEO to not spend any county resources on enforcing the state order. And that was for a couple of reasons. First, Governor Newsom himself has stated on several occasions that he does not expect this to be a law enforcement response. He is not asking local law enforcement to enforce his state order. Instead, he is relying on community pressure and relying on us to be self-policing when it comes to complying with the state order. And so that was the main reason that we directed the CEO not to spend any county funds enforcing his state order. The second reason is it's continually changing. Yesterday morning at 9 a.m., what was in the state order, we noticed at 2 p.m. in a meeting we were in the afternoon, it had changed. And so it is very difficult for people in the general public, certainly, but even for people working in the Emergency Operations Center on a daily basis in our county, to be able to keep up with what is allowed and what is prohibited by the state order. As one example, yesterday morning, pet grooming and car washes, which we have now allowed in our county for well over a week, were not allowed by the state order. When we started to allow them, they weren't spoken to at all in the state order. And as Dr. V explained, we felt the purpose of our order, in part, was to help define some of those gray areas. Yesterday morning, and since I believe last Thursday, it had been in a later phase of the governor's state order, not allowed to be open at this time. By 2 o'clock yesterday, pet grooming and car washes was an allowed activity in the current phase under the state order. So that's an example of how it keeps changing, and it just doesn't make a whole lot of sense to enforce an order that is changing sometimes on an hourly basis. So those are the actions that were covered by the Board of Supervisors yesterday. And when you ask about what's in the state order that is different from the local order, it's really hard to say. We're directing people to read it themselves. They can find it on our Stan Emergency website in the same place that our local public health order used to be posted. So if you go to Stan Emergency, click on the COVID graphic, then that will take you to the page, and about a quarter of the way down the page, it will refer you to the state order, where you can see the detail of what is allowed to be open today. Generally, it's very similar to what we have, especially now that it's been amended yesterday. So pet grooming, automated car washes, curbside retail, outdoor activities, all of those things are allowed under the state order. And we encourage people to look at it daily because it is changing.
Thank you, Supervisor Olson. Thank you for clarifying those things. There is a lot of questions and concern from the Facebook community. A lot of people think that since we're no longer enforcing, that they should just be able to do whatever they want. So what if everything should open, movie theaters, et cetera? What would you say to those people who are confused about that?
We would have a lot of concern about that. And I've been encouraging people all day to go to Stanislaus County's website. If you go to the website and click on County Services, you'll see Board of Supervisors. And after a couple of clicks, you can actually watch yesterday morning's meeting so that people can see firsthand what was discussed, what was said. All decisions made were guided by the public health officer. But no, we said very clearly in yesterday's meeting, it is not safe for all activities and businesses to reopen. I'll speak for myself and my own family. I would not take my kids into a movie theater right now. That is an example of an activity or a business that is not yet safe to open because it's a mass gathering environment. Now, at some point, we will move into a phase where that can be done safely under social distancing, possibly PPE and sanitation protocols, but we're not there yet. And then the most obvious example that is just not safe right now are mass gatherings. People really need to continue practicing social distancing, remaining within their household units. You know, there are a handful of exceptions. The state order, for example, has aligned with the Bay Area counties in allowing gatherings of children, of 12 and under children, not age 12 and under, but groups of 12 and under for various activities. But apart from that, we strongly encourage people to remain within their households.
Thank you, Kristen. This next question is for Assemblyman Adam Gray. Welcome to the show. We appreciate you being here to discuss what's taking place at the state level. And we're curious about what your conversations at the state level have been like. Can you share with us how you are advocating for Stanislaus County in the way of reopening our economy and what Kristen just mentioned, while also protecting the health of our community?
Great. Thank you. Well, thank you, Linda, Amy, Dr. V, Supervisor Olson. It's great to have a chance to be with you here this evening. Let me break that question into two parts. First of all, my office has been directly involved in working with our other elected officials, our city and county governments, to make sure that our community has the supplies we need. Right, and that's been done in several PPE drives organized throughout our community to ensure that first responders, essential employees, and of course larger community can get the supplies they need to be safe. We have organized several blood drives in our communities here in Merced and Stanislaus County to ensure that the hospitals and healthcare providers have that blood when they need it. That's something that's been overlooked in a health crisis like this, but it's an important thing, and that's something each and every one of us can do to contribute. And we've also, I've personally put money into trying to make sure our food banks have the food they need. We're raising money in the larger community, and I encourage everyone, if you're able to participate in that. It's a challenging time, and there's a lot of folks out there who need help. Then let's talk a little about Sacramento. In Sacramento, legislatively, I've focused on several things. First and foremost, I've been a fierce advocate on making sure our local governments get the funding they need. Unfortunately, our federal government didn't do the job they needed to do in getting money to all of our local cities and counties. There were larger cities and counties that got some direct money. Some of the other counties have been left looking to the state. There's $8 or $9 billion still at the state that I think some of which can be dispersed out there to help these communities throughout California, largely in rural communities. I've also been working very closely with Sheriff Dirksey here in Stanislaus County, as well as the State Sheriff's Association, to address this issue of irresponsibly putting prisoners out into communities throughout California with no standards. You know, several years ago, the legislature passed legislation to require our hospitals to, in fact, take certain steps before putting a patient who maybe doesn't have the means to support themselves in the community out on the street. And I think it's ironic that we find ourselves in a position where we're taking folks in incarceration and putting them out on the street with very little measures or assistance or direction to our local governments, and sometimes not even notifying me. It's just unacceptable, and we're working closely to find a solution to that. And finally, I've spent some time on a subject that many of you will know is familiar, and that's my advocacy for improving our healthcare infrastructure here in California, and more specifically in the Central Valley. You know, here in Stanislaus County, you've got about 157 physicians per 100,000 people. Merced County, which I also represents, has 92 per 100,000 people. The state average is nearly 300 per 100,000 people. So we have anywhere from half to a third of the physicians in this community that other communities have. And why does this matter? Well, it matters when Fresno tries to put beds in place to deal with the COVID crisis, and we have to put up 100 less beds here in the Central Valley than we could have because we don't have the physicians, the nurses, and the nurse practitioners to support it. And that's why even in this challenging financial time, the state needs to not only keep its commitment to build a medical school here in the Central Valley, but we need to expand our nursing programs at our community colleges. We need to help Stanislaus State produce more nurse practitioners so that the next time we find ourselves in a crisis such as this, we're more prepared. Now, I know that's thinking down the line, and a lot of folks are focused right now on the problems that are front and center and that you're dealing with every day, but we must also keep in mind making the preparations now for tomorrow and for the crisis of the future.
Thank you so much. We're going to stick with you for a moment, Assemblyman Gray. We're going to talk a little bit about the economy and what Supervisor Olson alluded to regarding the confusion at the state level.
Yeah.
We know the governor recently announced he is reopening parts of the economy, and we've sort of watched as some counties have opened up slowly, but there seem to be different rules for different areas. So what is going on, and what is causing some of the confusion?
Yeah. Well, this is an issue that's come up. I've had a lot of conversations with Supervisor Olson and with others on the subject, and frankly, I'm very sympathetic. I put down a few points, and I want to go through these very methodically. One, the confusion that we're all experiencing, frankly, stems from the state's poor communication to the local governments. And I think that needs to be said. You know, announcements get made on Facebook Live, press conferences, and oftentimes the details of those announcements don't follow for days or even weeks. Local governments are left tasked with enforcement, but yet they can't do their job if the state's not communicating effectively. All of this has resulted in frustration, decisions by many local governments to frankly not enforce some of the orders, or at least the perceived orders from the state. And on top of that, I think we've seen some pretty significant hypocrisy. Let me give a real concrete example. Tesla, who everybody's familiar with, makes electric cars, gets to open against orders, and it receives no punishment, frankly, for doing so. And then a local restaurant in my community opens and is shut down by the local health department. Well, that looks like politics, not good public policy. And I think it's important that we address that going forward, as we come out with these orders. And I think the biggest takeaway of the entire thing is trust your local government. Let's pay a little less attention to press conferences and even Facebook Live like we're doing now, and take faith in your local public health officer, your county supervisors, your sheriff. I'll tell you, I have faith in them, and I know they're doing a good job. And I want to also say to everyone that, California's a huge state. I think that's oftentimes lost on us. The Central Valley is home to 4.5 million people, roughly. If we were our own state, we would be the 25th largest state in the country. So half the country is smaller than just this little valley, right? And that's not to take into account LA, Orange County, San Diego, Northern California, the Bay Area. So this is a very, very diverse state. And with diversity comes significant challenges. And so, with all respect to all of our elected officials, from the governor down to the mayors and the supervisors, this is a challenging time, and they're challenging decisions. And I'd like to kind of end on the point that, too often I feel like I'm picking up the newspaper or looking at something on Facebook, and I'm seeing the suggestion by individuals, by some elected officials, as if there's a Republican solution to COVID-19, there's a Democrat solution, and the reality is what we need is an American solution. So we need to pull together, we need to alleviate some of this confusion, and most importantly, we need to all work together. So.
Thank you so much, Adam. This next question, and since we're on the topic of confusion, is for Supervisor Olson. The state's order has been somewhat confusing, and we know that you've expressed frustration with the changing information. Stage 2, for example, is presented in 2 phases. A lot of people are eager to get back to work. Can you explain what phase we are in and what it will take to get businesses opened based on the current state order?
Yes, I can. And as you said, there is a tremendous amount of confusion. Assemblyman Gray has just spoken to that as well. And I do want to, I guess, explain to people part of the reason for the confusion is everyone at every level, local, state, federal government, is really trying to do their best to make the right decisions when a lot is unknown. Right? As I said at the board meeting yesterday, nobody in our lifetimes has ever had to lead during a pandemic. And so people really are working hard to do the best they can, given the information we have, guided by public health, to make the right decisions. And I think that's probably why, in part, at the state level, we see the order continually changing. We see something in one phase, and then it's moved to another phase, right? And that it is incredibly frustrating and confusing for people. But I also think we need to be extending grace and kindness and understanding to the extent that we can, because people are just trying to do their best. But to get specific to your question as to what is in what part of phase 2, because now we have phase 2A and phase 2B. And phase 2A in the governor's statewide order includes things like we talked about earlier: car washes, pet groomers, curbside retail, takeout restaurant food, etc. Phase 2B, which is where we believe, and our public health officer believes, based on our local data and medical science, that we are ready to move to in Stanislaus County. Phase 2B includes things like dine-in restaurants. Not at full capacity, not like we used to dine in restaurants, but at some level of capacity, probably 50%, under various social distancing and sanitation protocols. Those guidelines came out from the state yesterday and can be found both on the state's website as well as on a document that we've worked hard to prepare in Stanislaus County in partnership with a number of different business leaders in a document that we call Good to Go. And if people go to the Stan Emergency website, click on that COVID-19 graphic that everybody is really familiar with now, that will take them to a page, and about halfway down they'll see a giant emblem. It's green and it says Good to Go. If people click on that, they are taken to a number of sector guidelines that guide how various businesses, be they restaurants or pet groomers or gyms or hair salons, can safely reopen when the time is warranted. And so in each of those pages, the state has now provided guidelines for activities or businesses that they've already opened. There are a handful of very small counties that are allowed to do dine-in services now, so the state has provided those guidelines. And in our Good to Go document, we provide links to those guidelines. So whether they were provided locally or by the state, everybody can go to that one document called Good to Go to find exactly what those guidelines are. But in that phase 2B that we're trying to move into, trying to seek authority from the governor's office to make those local decisions, it would include things like dine-in restaurants, like being able to go into retail shops to purchase clothing or shoes, etc. As so many of us have said over and over again, it frankly makes no sense that I can go buy a couch at Costco, but I can't go buy the same couch in our local home furniture store. And so those are the types of activities that would be allowed and businesses that would be allowed to open under phase 2B. As I said earlier, we'll be submitting all of our documentation on Friday to the state, asking to be empowered to make those decisions locally, seeing that our local data points, our medical science, our public health officer believes we can safely move into that phase. There are other aspects of the economy that the governor doesn't have in his statewide order until later phases. Phase 3, for example, includes hair salons, gyms, churches, etc. And he has indicated that those decisions are a ways off. But again, we will continue to ask for the ability to make decisions locally, guided by public health based on our local metrics for those businesses and activities as well.
Thank you so much, Kristen, for that explanation. For those of you who may have tuned in late to the feed, once this posts, we encourage you to go back and watch the video from the beginning, as your questions may have already been answered. Let's change gears for a moment and go back to Dr. V. I know that we talked earlier about touching on testing, and there have been a lot of questions still coming in about testing. Because we now have multiple testing sites, most anyone who thinks they should be tested for the virus can be. What is the window of time someone would test positive when they think they're sick?
Oh, good question. So people usually test positive from about 2 days before symptoms start, and they can test positive for quite some time. Now, this test detects, like we said, the DNA, the RNA of the virus. It doesn't necessarily mean that virus is alive. So, I mean, the virus can be dead. We do know that from the CDC, they haven't been able to culture it past 9 days, so that's why our isolation is for 10 days after symptom onset. But so the test, the PCR test, has been positive in some people for a couple weeks. So it can stay positive. I wouldn't want to depend on it being positive for more than 2 weeks after you develop symptoms. I do want to go back to our testing and our testing sites. We have a lot of testing sites and availability to collect these specimens, these samples from your nose, which is a delightful test, so I'm told. But they are not being used very much. In fact, we have a lot of capacity for people to go. We have opened it up to be anyone who is symptomatic should be able to go and get a test. You go online and sign up at one of the two sites, either the Verily site, which is in Salida, or the OptumServe sites, which are in Keys and in Patterson. The Salida site is a drive-through site, so you don't have to get a car. Your OptumServe site, you go into a building for those other two sites. And so they all have capacity to do more than 100. The Salida site is 200 a day, and currently now they're doing less than 100. So we have a lot of capacity to get people tested, and I urge you that if you have some symptoms, go in and get tested.
Dr. V, we'll stay with you for just a moment. One of the concerns, and we've seen this question pop up, is positive asymptomatic people, which is why you continue to recommend face coverings. Mm-hmm. What percentage of people could be walking around asymptomatic?
So it looks like from what they have seen, it could be up to 20%. So maybe about a fifth, which means 80% will have symptoms, but about 20% may not have symptoms or may not recognize the symptoms. Maybe they just feel a little tired for a day or two and they don't really relate it to the fact that they may be ill. I think more importantly than that is that a lot of people can test positive and have quite a bit of virus by the test a couple days before the symptoms. And so if you add those in, it can be a pretty significant proportion of people that can actually pass this infection, spread it before they even know they're sick or before they ever know they're sick. So face coverings can help prevent that. And we're slowing down the spread some.
Thank you, Dr. V. Let's go to Assemblyman Gray. Adam, there's a lot of pressure we know on Governor Newsom to relax the state public health order so that we can reopen businesses as soon as possible. Do you believe the governor's staff will make concessions regarding the roadmap released last Thursday, which outlined the guidance for local variants?
Yeah, well, I'll go back to my previous comments that first and foremost we should trust our local elected officials. But I think the goal of county variances obviously are to take into account the diversity of California, the differing circumstances, and give people a mechanism with which to permit activities in counties that are appropriate for that county, appropriate to the circumstances, and of course the metrics. And so I do believe the governor's staff will continue to amend and adapt, and I think Supervisor Olson said it best in that everyone at all levels of government is doing their best and does have their heart and mind in the right place, but we are going to have to continue to amend and evolve those guidelines so they fit and they fit all these unique areas of California.
Thank you so much, Adam. I'd like to move over to Supervisor Olson. A lot of Facebook community members are asking if the drive-in movies, community pools, and playgrounds will now be closed.
It's a good question because it's an example of where there's just a disconnect between the state order, Sacramento, what's handed down to us, and what's actually happening in our local communities. As people know, those activities were allowed under our local order. With community pools being qualified as only if social distancing can be practiced, in some community pools it is easy to not mingle with anyone outside of your household. In others, that's difficult. And so we have always made it clear that for community pools, they are open as long as that social distancing can be practiced. It's very difficult, we would suggest not possible, to roll back things once they've already opened. And the state order isn't quite clear on a number of these issues. For example, drive-in movies aren't discussed in the state order. That was a creative, innovative idea brought to us by a lot of nonprofits and private organizations, churches who thought they could open their parking lots and provide a fun, entertaining experience for people in a safe way, similar to the drive-in churches that are allowed under the state order. And so we believe it's still fine for these drive-in movie activities to take place here, for our playgrounds to be open. Medical professionals at the national level have made it very clear that the virus, and Dr. V can speak to it better than I, but that the virus doesn't survive on playground equipment in the heat. And so these are safe activities that will remain open in Stanislaus County. Keep in mind, though, that parks within city jurisdiction, it's ultimately up to that city on whether and when they plan to open their parks. I think most have been reopened, but not all in all cities.
Thank you, Kristen. A lot of questions about what can be open and what can't be open. So this one came in as a Facebook message and asked specifically, if cosmetologists open their salons, can the state still take their licenses even if the county opened up?
They can. There's been a lot of confusion around hair salons, nail salons, etc. Some people seem to believe that those counties, those small counties that have received a variance from the state, have allowed these salons to reopen, and that actually isn't the case. Under the governor's order, hair salons, nail salons, etc., are in phase 3, and the counties who have received a variance, Yuba County, Sutter County, Placer County, El Dorado County, the one closest to us is Tuolumne County, they only received a variance in order to move all the way through phase 2, which did not include salons, gyms, etc. So even in counties that are more open than us because the state allowed them to do that, those types of services are still not being allowed.
Thank you, Kristen. This next question is for Assemblyman Gray. There is a lot of pressure on Governor Newsom to relax the state public health order so that we can reopen businesses as soon as possible. Do you believe that the governor's staff will make concessions regarding the roadmap that was released last Thursday, which outlined the guidance for local variants?
I do. I think the governor's, in fact, I think we covered this a little bit in the previous question, but the governor's staff will continue, I think, to amend and adapt their guidelines to these different circumstances. And of course, the local variance is in fact just that, a local variance, given the fact that we're going to have different set of criteria and data for each and every city and county up and down the state, which is diverse.
Thank you, Adam. We'll stick with you.
Okay.
We know a lot of people in the Central Valley are hurting and across the nation. A lot of working families have lost their jobs and can't pay their rent. So what is the state doing to help people stay in their homes?
Yeah. Well, for one, we're obviously doing everything we can to help those who've lost their job, right? And that's come through the form of unemployment assistance. Certainly both the state and the federal government have tried to expand those benefits in this time of need. Now, it's been a challenge, and I know in my office we've had sometimes dozens, if not more, calls per day of people who have filed trying to get their unemployment. We're trying to assist and make sure that gets done. There's an enormous number of people. There's the same number of people working at the agencies that administer that and get those checks out the door. I think they're doing a terrific job, but there's a lot of frustration out there, and I encourage you to contact my office if you're having a challenge with that. And of course, some of the other steps, the governor and the legislature have taken is working with many of the big lenders. We've asked folks to put a pause on folks' mortgages. There's been a moratorium or pause on evictions for failure to pay. But one of the things that concerns me as we look forward is those are all great, very near-term solutions. But at some point, if you're somebody who's living paycheck to paycheck and all of a sudden you're 4 or 5 or 6 months in arrears, that's going to be a real challenge, and I don't know how folks will get out of that. And I'll tell you, the solution is, I know there are a lot of folks out there that are using the taglines and the cancel rent and this, that, and the next thing on how to solve that. But of course, we also need to consider there are people that have mortgages on a rental property or maybe several apartments. And so the answer isn't either of those. We need to find solutions that work for every Californian and every American. But it's going to be a difficult road ahead, because I think we're digging ourselves a big hole with this economic kind of collapse in the near term, and it's going to be a challenge climbing out of it, and we're going to need everybody working together at the state, local, and federal level to do so.
Thank you, Adam. This next question is for Dr. V. We're getting multiple requests about this, and it's a question we've seen a couple of times over the last couple of weeks. What are the county's thoughts and plans for summer youth sports, fall school, and school sports?
Yeah, that's really a hard one. So, I don't know. We're waiting to see what this virus does over the summer, what it looks like it's going to do in the fall. You're seeing more and more, and we're all worried about a fall wave, because I talked about it last week, I believe. Saw it in 1918, you saw it in 2009. Respiratory viruses tend to come back in the fall. So fall to me seems a bit more iffy. Summer, I could see more. We have to recognize that kids' sports are gatherings. They're gatherings with the kids who aren't going to stay social distanced to play the sports. The parents are there watching, and they doubt that they maintain their social distance. So I think it's a really hard call on those activities. And I think more is yet to come, getting us some guidance on that. So that's a really difficult one. I get that question a lot, and I am not sure what's going to happen with sports for kids for the summer and fall.
Thank you, Dr. V. Another question for you from Facebook. This comment said, I know that face coverings are not required in our county, but I'm curious about Dr. V's opinions on counties that are requiring face coverings even outdoors, such as on trails like LA County and San Mateo. As a nurse, I get confused seeing people in our community driving in their cars wearing face coverings or out walking their dogs wearing them. Shouldn't they only be worn when you are at higher risk of being within 6 feet of people?
Yeah, thank you for that question. I get a lot of questions on face coverings and my opinions on them, and I strongly recommend them. I say that all the time. And really the purpose of them, as I think you all know now, is to prevent you from spreading to others. It keeps your respiratory droplets away from other people. So where you really want to wear them is, yes, when you're within 6 feet of someone who's not within your household. So they're important, I think, to stop spread. So there's a couple questions in there. If you're in the car, well, we actually do recommend them if you're carpooling with members not in your household, because that's something that can decrease spread within the car. If you're alone in the car, there really isn't a reason to wear them, but maybe people are just trying to get used to wearing them all the time. Maybe they need to wear them all day at work, and this is just part of what they're doing. So they don't need to wear it in the car alone, but they can if they want. And then outside, if you don't know when you're walking if you're going to get within 6 feet of people, so you can wear them. If you're around your house, I think it depends on how busy you are. It is outside. If you're like in a downtown area and sidewalks and there are people around, it's probably a good idea to wear one. It is a good idea to wear one. If you're, around your home and nobody else is around and it's just you, I think it's fine not to wear one. I think we just have to think about how we use these and when it's best to use them. But yes, definitely when you're within 6 feet of anyone who's not in your household. So again, the first part of the question was about orders, and I say this quite a bit. To me, orders are something that they have the force of law behind them. It's actually a misdemeanor to violate a health officer order. And I think face coverings are something everyone should wear. I think it's a good thing to do. I don't order people to stay at home if they're sick. I don't think that's very enforceable. I don't think face coverings should be enforced, as opposed to we have orders for isolation and quarantine, which I'm more willing to work to enforce. And so there are differences to me about what I order and what I wouldn't order. And some people might disagree with my assessment, but that's my assessment.
Thank you, Dr. V. This next question is for Adam Gray. This question is from our live Facebook feed. Carolyn Huff is asking, when will the legislature reconvene to stop the governor from acting unilaterally?
Well, thank you, Carolyn. Appreciate that question. And I think you actually raised a very important point. The legislature does act as a check on the executive, and I think oftentimes that point is lost in a state where both the legislative and executive branches are from the same political party, and so there's not always discussion or interaction. It's more often seen when you have the two parties controlling the two different institutions, such as we see in Washington, D.C. But the answer is we have. We're back as of last Monday in Sacramento for precisely that reason. I actually convened a hearing just this week where we dug into some of the no-bid contracts that have been issued around PPE supplies, and many of you have probably read about that in your local newspapers or perhaps seen some discussion on the news in the evening. And those are important issues, and we need to make sure that we're holding ourselves accountable, holding certainly the executive branch accountable. That's one of our duties, and one that we're back in Sacramento carrying out 4 days a week right now.
Thank you for that, Adam. You just touched on this, but I'm going to go back to it because it is a question that came up to us. The news has reported that the state lost billions by signing contracts for PPE with fraudulent companies in China. How much money has been lost, and what is being done about that?
Yeah, so it's, again, a great question, and it does piggyback. We had a hearing. We brought the Director of Office of Marine Services in, as well as other members of the Executive Branch. We had the State Treasurer, Fiona Ma, testify before our committee. The good news is the state hasn't lost a penny on contracts, and that's a great thing. The bad news is, in at least one instance, that's because some private sector bank individuals stopped some transactions where the state was going to send money to folks that, at least at first blush, seem to have been trying to capitalize off of this public health crisis and make some money or start a new business. And I think that's unfortunate. It may not be illegal. I think it's unethical and immoral, and we need to continue to root out those examples and certainly ensure that they're not happening going forward in the near term, but also make whatever necessary changes or create additional requirements in the law so that in the future we don't see this kind of thing happen. I will say this in defense of the governor. I think there is a certain amount of risk that's acceptable during a public health crisis. When people are dying when we don't have masks, then all of us have a responsibility, myself, the supervisors, et cetera, to do everything we can to make sure that we bring those supplies in. Having said that, a certain amount of risk needs to be mitigated with proper procedures and protocols that ensure that state taxpayer dollars aren't wasted. So thank you for the question.
Thank you, Adam. Moving from the state back to local government for Supervisor Olson. What conversations are we having with state policymakers to advocate for a change in the public health order that would allow for more local control?
We actually have very frequent conversations with our state public policy makers. In fact, every single afternoon around 3 o'clock, the mayors and I, all 9 mayors and I, are on the phone with our state elected officials, our federal elected official, and or their staffs. That is literally a daily activity, oftentimes even on weekends. And our state senators, our state assembly members, Congressman Harder, are all working hard on our behalf. At the state in particular, they are aware of our request that the governor empower local decision making. They are working in partnership with us to communicate that to the governor's office, and they're as frustrated as we are that we aren't being empowered at this point to make decisions based on our local data, based on our local medical science, and the direction of our public health officer.
Thank you, Supervisor Olson. Another question from Facebook viewer Jeff Messer for Dr. V. Jeff asks, if positive cases increase, not deaths, because we should be preventing positive cases, what is your threshold for reinstating the shelter-in-place order?
So there is guidance that we have proposed following. I don't know if the state or the state public health officer are going to have different guidance, but for right now the plan is to use guidance that was developed by a nonprofit called Resolve to Save Lives. Tom Frieden works there. If you remember, Tom Frieden was the previous CDC director. So they've come up with some great guidance, and it's actually pretty long. There are criteria, about 5 in each column, one from healthcare, one from epidemiology, and one from other markers. And so we put that in our plan as what we would like to follow to look at. So some of the things in there, I can give you example, is increasing hospitalizations, more admissions than discharge for a certain period of time, increasing case counts, increasing deaths, case counts in healthcare workers. Those are some of the markers. There's quite a few of them, but there's a whole bunch of different things we can look at, trying to see when we're really seeing an increase and know that it's time to at least slow everything down. And another thing is that we're trying to move ahead slowly, not just open wide up. That would be a terrible thing to do. Open up and try to go back to the way everything was before. Well, that's just going to have transmission really increase. So opening up slowly, starting our mixing slowly, and always remember to keep that distance of 6 feet with anyone not in your household member. And I think that is what we're going to be able to do to be able to open up more businesses and more mixing, as long as we stay with that 6 foot distance. And the other things, wash your hands, stay home if you're sick, all those good guidance, wear your face coverings to slow transmission so that we can continue to move forward.
Thank you, Dr. V. This next question is for Supervisor Olson. I think we only have time for one more question. And this comes from Julie Ann on our Facebook feed. Julie's asking, when will state and county campsites become open again?
So we do have some good news to report. We have a number of reservations. I forget exactly how many, but a shocking number of reservations for our county campgrounds beginning in June. So we can't speak to when private campgrounds or state campgrounds may open, but for our county facilities, we do plan to open them up for some camping in June. There will be more announcements soon. We're working out the staffing details. We're working out the social distancing protocols, et cetera, to make sure that we can safely reopen those campsites. But we will be opening them to some degree in June and expect to be able to provide more information to the public about that within the next week or two.
Let's go back to Dr. V. One more question that I think is important to address here. Chris asked, when can 12-step meetings open?
Oh, that's a really great question. That's another one. I think it will be difficult to do this in person in the near future. We're waiting. The governor right now in the order is no gatherings right now, no gatherings outside of your household. So it's possible that sometime in the future that will change. And so if it increases to, like, say, 10 people, then gatherings of 10 people or less could happen outside the household. Otherwise, I think there are various other ways that meetings can take place. I don't know if that technology is present for those meetings, like Zoom meetings and other ways that you can support, although remotely. Not ideal, but I think better than nothing. But for meeting in person, I'm not sure. I have not been informed of when we think that will move forward.
Thank you, Dr. V. I'm going to go back to Kristen, actually, just real quickly. Kristen, You talked a little bit about some of the reservoirs and campsites opening. Did you want to talk quickly about some of the shoreline activities and when we could expect to see some of those things come up?
Sure. So just to repeat real quickly for people who may not know or may have forgotten when the reservoirs are opening, on May 16th, Modesto Reservoir will open for boating and watercraft activities only. On June 6th, Woodward Reservoir will open for boating and watercraft activities. In the meantime, we are evaluating our staffing plans with both the Parks Department and the Sheriff's Department. We are talking with the Public Health Department and the Public Health Officer about how we may be able to open some shoreline activities as well, in addition to camping, as we just discussed. So we're excited to make some announcements soon. A lot of hard work is going into making sure we can find safe, fun ways for families to enjoy the outdoors as summer approaches.
Thank you so much for that. We want to thank all of our panelists for being here tonight and answering questions directly from our community regarding COVID-19.
Also want to thank those of you at home for sending in your questions. And remember, if we didn't get to your question tonight, we'll continue to work on answering them both online in the comments and in our daily updates throughout the week.
Also, don't forget to join us tomorrow night for a special live Q&A event to discuss our new safe worship guidance for faith-based organizations in Stanislaus County. City Ministry Executive Director Marvin Jacobo will be joining us, as well as New Life Christian Center Executive Director Dr. Brett Avery and lead pastor from the Redeemer Church, Dr. Jim Applegate.
So thanks again, and we'll see you next Wednesday for another Facebook Live Q&A at 5:30. Stay safe, stay healthy, and stay informed, everyone.